Hey everyone, thank you for joining us today with Canyon Angels. My name is Spencer Baz and I'm the director with Canyon Angels. And we have Matt Likens here from GT Medical Technologies. Thanks for driving over here today, Matt.
Sure thing. Good morning.
So Matt came to Canyon Angels December 7th for one of our investment rounds. And let's just start it off with, you were an investor at one point. How did you come across Brian Martin and how did you get involved with GT at the very early stages of the company?
Yeah, so I guess at this point, now we're into early April. It was about a year ago that Brian Martin reached out to me, and I had met Brian 4 or 5 years ago through a mutual friend. And he said he was considering taking a consulting role to support a group of clinicians out of the Barrow Neurological Institute, and he wanted to run the idea by me. So we met for lunch. He talked to me about what ended up being GammaTile, and told me everything about it, and talked about the 5 clinicians who he was working with, and said, what do you think? I said, it's interesting. Keep me informed as you go through this consulting agreement. And so didn't hear from him until June or July of last summer. And at that point, he said, wow, this is really compelling. I'd love to tell you more, and I'd like you to meet the CEO. The CEO is Dr. David Brackman, a radiation oncologist who was one of these 5 clinicians from Barrow. And he'd been working on this for about 6.5 years. So we met for lunch, and I was impressed with Dr. Brackman and impressed with the number of patients that had already received GammaTiles as a brain implant. And then Dr. Brackman called me 2 weeks later, and he said, I'd really like your advice on something. And they had received a licensing offer from a major medical device company and wanted me to review that. I reviewed it and told him I didn't think it reflected the value that they had built. And he said, would you mind sharing that with all 5 founders? And I said, only if I'm allowed safe departure from that meeting, because I'm going to tell them to turn down money. And these 5 clinicians had bootstrapped the technology up to that point. They paid for it all out of their own pocket. And so we did meet on a Sunday night at Barrow, and I told them what I had told Dr. Brackman, that I just didn't think it reflected the value, and I would advise them not to take the offer. They said, well, what do we do instead? I said, well, the other option is to turn it into a company and hire a management team and raise some funding and really turn it from a clinical development program into a real company that can do additional clinical trials, but more importantly, commercialize the technology and allow patients around the world to benefit from it.
Right.
That may have been longer than you wanted to know about it, but that's how I got involved.
So then GT's vision, if you can refresh some of the investors that were at our investment round 4 just December 7th, just a couple months ago. So
yes.
If you could just refresh the investors that may have seen your company come through the state of Arizona, maybe in the Southwest. Love to hear what you think the company's at and just vision in general.
Yeah, so it's GT Medical Technologies, and our purpose as a company is to improve the lives of patients with brain tumors. And how do we do that? Well, we deploy this technology, and it's been implanted now on 108 patients, all at the Barrow Neurological Institute. And these patients had been implanted, they had had previous surgical procedures to remove tumors, and then had the standard course of therapy, which 3 weeks after the procedure is done, they go through approximately a 6-week regimen of external beam radiation to try to take care of the residual tumor cells that are always left behind, because the neurosurgeon needs to be very conservative in removing a tumor not to affect adjacent tissue that can affect movement, memory, and other critical functions of the brain. And so those patients had had that previous procedure, and then the same patient unfortunately had a recurrence of the tumor, and then they had a resection again, another surgical procedure, and in that second procedure, GammaTile was implanted, and there was no need for external beam radiation. And then we've monitored the data, and the fact is that those patients are surviving much longer without a recurrence compared to their previous procedure, which is against what normally happens. Typically, a second recurrence happens faster. And so compelling data that says that a gamma tile approach and local radiation with this technology is much better.
And that 6 months to a patient is, I mean, that's critical, especially what they're going through right now with, going through some of the procedures, right?
Well, yeah, and in fact, the data shows, at least to date, that there's at least a 12-month improvement prior. And in fact, 60% of the patients that had received a gamma tile still had not had a recurrence of their tumor. Yeah, so it's so the vision really is to improve the lives of patients with brain tumors, but also to establish a gamma tile radiation approach as the new standard of care for patients that have brain tumors that need to be resected or surgically removed.
And then for some of the first-time entrepreneurs that come through Canyon Angels, talk to them a little bit about seeking angel investing. What's the process like? If you could just share just some words of wisdom, just even communicating with different angel groups, not just in the state of Arizona, but in the Southwest.
Okay, I can certainly comment. I don't know about the wisdom portion of it. We'll let them decide on that. But from my perspective, I think the founders of GT Medical Technologies, the 5 clinicians, and again, Dr. Peter Nakaji, the neurosurgeon, 3 radiation oncologists, including Dr. David Brackman, and their clinical coordinator, Terry Thomas. And I think they did it the right way. They bootstrapped the company for 6.5 years. And I think for entrepreneurs, the longer you can move your company's prospects forward without taking any outside money, the better off you are. Because the more progress you make, the more milestones you achieve, even on a shoestring, when you do go out to raise money, first of all, you'll be able to cite everything that you've accomplished so far with very little funding, if any, and then you will get a much better valuation when you do raise money, and you'll be able to keep more ownership of the company yourself. So I really encourage early stage companies to scrape by as best you can, as long as you're not hurting the future value of the company by being too penurious or frugal in your approach.
What about the cap table? So a startup company is looking to seek funding, and they just screwed up the whole cap table prior to that. What's some ways that maybe an entrepreneur could at least make sure that they're doing the right things necessary cap table wise before they're seeking an investment, not getting friends and family, not keeping track of what equity may have already been established by people that have already previously invested before an angel investor could come in? Could you elaborate on the cap table perspective?
Yeah, and so I think there's temptation there, right, to take any money that's available, independent of where it comes from, because you need that fuel, to achieve your dream and the business goals. And so I would just encourage people to be very thoughtful in those early stages. And if you are going to take money, make sure it's from someone who may be in it for longer than just that round of financing and has a vested interest in your success, someone you wouldn't mind working with and communicating with on an ongoing basis, because you'll have an obligation to do that and to keep them informed as you continue to progress the company. And so I think that's the main thing. And then don't take it unless you absolutely need it.
And FDA approval right now, how's the process coming along for GT? If you could just elaborate a little bit on that.
Yeah, and so maybe just overall, we've had a lot of accomplishments in the last couple of months.
Talk about some of the milestones, at least that GT's met so far from just that investment period in December, but in general throughout the company. What have you guys achieved so far?
Yeah, so even with 108 patients being treated at this point, we had not submitted a clinical paper to a noted publication when we talked before. And so the first paper was submitted just about 3 weeks ago to the Journal of Neurosurgery, and that recounts the meningioma patients who have been treated. And in fact, those patients, there were, I believe, 20 patients in the first 62 patients treated. None of them had experienced a recurrence of their tumor. Should be a very impressive paper. We're hoping to get it published relatively quickly, so we'll at least have our first scientific publication. Many neurosurgeons and scientists will not adopt a new technology until you have something in a peer-reviewed journal. And so Journal of Neurosurgery represents that. Beyond that, Dr. Brockman joined us full-time on March 1st as our Chief Technology Officer, and so tremendous addition to the team. We are about halfway through a biocompatibility study that the FDA was recommending we do prior to their clearance, and the data looks very good thus far, so that's moving toward an FDA clearance. We're still hopeful for a summer clearance by the FDA and a limited launch of the technology before the end of the year. We've also, we just added last week, we grew our organization by 25%. John Baker is manager of technical, the technical engineering and working on the supply chain and the manufacturing side joined us. So we have 5 full-time employees now. And on that front, we signed.
It's the percentage, right?
It does, it does.
25%.
Well, we like to think that we're growing by 25%. So, and it doesn't cost us as much as most 25% growths do. But,
exactly.
But also, we did sign a 10-year manufacturing agreement. That was one of the issues that the students brought up in due diligence. That, my gosh, you've got one supplier. How can you assure the continued supply of that radioactive isotope? And so that was accomplished as well since we raised the funding.
That's awesome. And then speaking about issues, because I think a lot of entrepreneurs obviously want to speak about all the good that's coming out, from the company and the progress that they're making. But to be fair to some of the entrepreneurs, right, it's a daily struggle. You've been blessed to at least have a nice exit in the state of Arizona. But what can you give advice-wise, and what are some of the issues that you've been able to solve by being CEO of GT? And if you could just elaborate just.
Yeah, so as CEO, the major thing that I need to do is make sure that we attract the right talent to the company. You mentioned blessed. I feel really blessed. The other 4 members of our team are outstanding, each of them. First of all, as human beings. Second of all, they're experts in each of their fields. And you met Brian Martin. Yeah. He's kind of doing everything for us now, whether it's finance or business development or some of the marketing research and healthcare economic data that we're trying to put together so that we know how to price the technology. Lots of work in a lot of fronts. Hernan Lopez, who was a superstar for us at Althera, the other successful startup that was part of in the Valley, is our VP of operations, and he's the one who brought John Baker on board, who also was a great asset for us at Althera, and of course Dr. Brockman. So we'll be looking. So one of the challenges is when you bring on additional resources, how confident are you of getting FDA and the timeliness of that? Because you don't want to create too much burn too early if in fact there's going to be delays. So we're working with a number of consultants, and so we're only paying them as they do work for us, so we manage our burn that way. And at the right point in time, the big challenge is when you bring them on board, will the right people be available when you need them? Especially now on the commercial front, we are refining our commercial plans for the limited launch and then for the full market release as well, which will happen in 2019.
And let's talk about the proudest moment that you've had so far, being CEO of GT. What's the proudest thing?
Well, I've been very proud to be, the company's been recognized in a number of different ways. So first of all, in late December, we got notification from the Arizona Commerce Authority that we were one of 6 awardees, I guess, of the Arizona Innovation Challenge. So that was a $250,000 non-dilutive financing that was available. We're in the process of getting the first $75,000 of that, and as we meet milestones during the year, we hope to get the rest of it. We also were awarded a Flynn Biosciences grant of $30,000, and we should be getting that through the year as well. And just 2 weeks ago, we had applied months ago to be part of a pitch competition, and found out over the last 2 weeks that over 700 companies applied.
Wow.
And so we were asked to compete in the San Francisco region, probably the most competitive region. And so I found out on a Friday that, oh gee, you're allowed to participate in this pitch. And they explained to us that there were 6 companies that have already been passed through to and it was going to be 6 days from that. And so 6 companies already passed through to the afternoon round, which is a 5-minute presentation and then 15 minutes of questions and answers. But you're allowed to participate in the morning session. There are 8 companies, each with a 1-minute pitch with 1 slide. And in that 60 seconds, the best 2 pitches can move to the afternoon round with the other 6 companies. And so we thought, my gosh, we're going to go to San Francisco, spend the money for a 1-minute pitch. You're kidding me, right? That's all we're going to get. But our largest investor, MedTech Venture Partners, is located there. So we figured that we could accomplish some other things. Long story short, we pitched for a minute. We said, yeah, come to the afternoon, and pitched again, and we won the region.
Wow.
So that's really tough competition in that region, and I'm proud for Arizona that we're not necessarily known for our innovation nearly as much as Silicon Valley.
Right.
And so to win there, I think, is a major accomplishment. Very proud of that.
And how can we as angel groups better serve entrepreneurs, startup companies in the state of Arizona as angel groups? What can we do better for you, as a founder that was trying to seek investment?
Yeah, first of all, I think the establishment of Canyon Angels and the process that I went through with you all was very impressive. I think the fact that you're getting student involvement at such an early stage, I think the folks involved will just grow in their knowledge and expertise in this area, which I think bodes well for the future. But the other thing you're doing, I understand you have a session next week where you're stimulating more angel interest and trying to recruit more angels. I actually had breakfast with the CEO of the Flynn Foundation last week, Tammy McLeod, who informed me that there are 158,000 millionaires in the state of Arizona. And she said, how do we capture some of that potential funding? How do we educate them about investing in at an angel stage? And so, in fact, I'm going to try to connect her with Tim Kelly and make sure that she's at least aware of what's happening next week, because I think she'd want to get on board and help do that. So I think, in general, the angel community can do a grassroots effort to unleash some of the funding that's available for the best ideas here.
I agree. And if anybody's interested in partaking at this event, it's going to be on April 11th at 2 p.m. We're going to have over 100 accredited investors. We're already over 100 accredited investors right now, so we may even be looking at 150 being in the room. So
cool. We're
trying to educate as many investors as possible and hopefully encourage them to take one step forward in venture financing and be a part of the growth in the state of Arizona. So again, thank you for joining us today,
Sure.
Matt, and we will let everybody know on the progress that we make as a group. And please come to our April 11th event at 2 p.m. next week.